Hi, my name's Ed Hope. I'm a junior doctor in the UK, and for the last 2 weeks I've been vlogging my experiences of being a healthcare professional on the front line during the COVID-19 pandemic. Because this is such a unique thing and the healthcare workers are very much on the front line of this battle, I wanted to capture that and give my view on what's happening on the ground. Okay guys, this is my COVID-19 vlog. Number 1. The date today, Monday the 16th of March. My car is full of my stuff and that's because I'm currently living at my folks, so just with everything going on, you know, they're sort of over 70, so I'm moving out because I don't want to, you know, put them at risk and bring anything back. So I'm moving in with my boss, and she's one of the consultant anaesthetists actually, and she's kind of heading up the stuff at the hospital with the coronavirus. I'm heading into work now, and I'll give you an update as things go throughout the day. So finding a parking space was as bad as ever. So far in the UK we've had 1,372 cases of coronavirus confirmed. Don't forget guys that 80% of people will be fine. They'll have mild symptoms, they can stay at home, they can manage. So it may seem like things are bad, you know, if we do see some cases. But just remember that these are the people that are really struggling from it. Hello.
So we're just going to taste test you,
right,
to see if we can then fit mask test you.
Just tell us when you start to taste it, alright?
Okay. It tastes like, yeah, it tastes really...
Anti-self paracetamol.
It does. It's medicinal taste,
I think it tastes like when you were a child and your mum used to say, don't lick money, it's dirty. You think, oh, I'm going to lick it now.
It tastes like a £1 coin.
It does.
Okay.
Great.
So we're almost up to 2 minutes. How long does it take?
7 minutes. Can you taste anything?
No.
So you wear this when you're dealing with a very high risk. You've passed.
Now take it off in there so you can show everybody what it tastes like.
You might not taste it.
Oh God.
Pear drop time.
Oh, that tastes like, that tastes horrendous. So it is 7:30 in the evening. We are seeing query COVID-19 cases. We've had, you know, a few in today, but I haven't seen any personally. I've seen some people that have been low risk, but I think their kind of symptoms were due to other things. But obviously we're taking precautions in those low risk patients, so we're having to wear masks and aprons and gloves, and obviously washing our hands regularly. But you know, we do that anyway in the emergency department while everywhere in hospital. Good morning all. I'm just going to go have a quick chat to Sonia, my new landlady and one of the consultant anaesthetists at the hospital. So someone is going to be under huge pressure.
Welcome to the Corona house.
It's just the Corona HQ in terms of our lives.
Yeah.
How are you feeling? I mean, it feels like the whole world's gone mad.
The view that I take on this is I've spent 20 years learning to be an intensive care consultant. This is the crisis that I have spent my life training for, and we are so lucky that we have a publicly funded health service that's accessible to everyone.
This is where we're staying, en suite as well, so that's an upgrade. Some of the things I brought with me: a bunch of board games. I'm not sure who I'm going to play them with because we're supposed to be social distancing. I brought this one as well. This is probably in bad taste, called Pandemic. It's actually a really good game. Not essential, but the Air Jordans, just to keep it comfortable. It's difficult to know how much stuff to bring because Boris Johnson talks about getting on top of it in 12 weeks, but this is going to go over many, many months. So the housing situation is likely to change throughout things. So I'm off to the shops now to see how apocalyptic the panic buying is. And also Sonia wants some Maltesers. No Nurofen or paracetamol. Great. Okay, if you want gravy and vinegar, you're all right. If you want pasta, no pasta for anyone. That's the bread aisle. Yes. Get in. Got the Maltesers. Ready for another shift in the emergency department. I think it'll be much the same as yesterday. It's been a fairly normal, good day. Yes, we're seeing suspected COVID-19 cases. I'm not going to sort of go into numbers because they're all kind of unconfirmed. One of the difficulties is just shortness of breath and respiratory illness is a common presentation to A&E. And so we won't always know when someone comes in what they have. They could just be like an infective exacerbation of COPD or kind of a bacterial pneumonia. They're the common things we'd see, outside of this crisis. So we have to really treat everyone like that as a kind of risk for COVID-19, and we won't know until we send the swabs off, and they take a couple of days to come back. They allowed me to keep the mask. You can't use it again. They're kind of single use. You realise we're going to go through an awful lot of these. I think in the normal kind of surgical masks, not these, we went through, I think, 9 boxes yesterday, just in one day. It just shows we're going to need a load of all types of equipment. You hear so much about ventilators, and I know you obviously need the staff of the ventilators as well, but all the other things we're going to need a lot more of, potentially masks, oxygen. People are obviously anxious, but it's not stopping people doing their job. And actually some of the camaraderie is as strong as ever, really. We had some people present today with mild symptoms that didn't need to be in hospital and were just demanding to get a swab, which is not the current advice. By them coming into hospital, they're potentially exposing all the other people, other people with health conditions, other vulnerable people to the virus. People come in with COVID-19, what type of things are we seeing?
The viral pneumonia that you get with things like coronavirus is closest to the severe pneumonia that you get with flu or influenza, and so it will typically have a sort of a flu-like illness at the onset, but with fever and cough developing into shortness of breath. And I think the typical feature of it is that it affects typically both lungs, whereas a bacterial pneumonia will affect one lung, and that's why it has a tendency to cause more severe effects.
Well, what would be the initial treatment then for someone that comes in?
The problem we've got is that we don't have many effective treatments. So a lot of the treatment is supportive, so it's really about oxygen. We, as you know, often end up giving antibiotics because we can't be sure it's not a bacterial infection. And so in terms of conventional treatments, that's about where it ends.
We're already seeing changes in the UK. You look at places like Northwick Park Hospital in London have already declared a critical incident due to the lack of ICU beds because of the coronavirus. If you look at all the projections, it's inevitably going to be coming to my hospital in the next days or weeks. We just have to do all we can for preparation. Don't forget, in 2017, the British Red Cross declared the NHS faces a humanitarian crisis. You have to put that stuff to the back of your mind. It's not the time to criticise. People need to just work with what they got and do the best we can. The other thing I want to highlight is testing. So currently NHS staff aren't being tested for the coronavirus routinely. And I saw this article in the news that a few patients from the Portsmouth football team, so a soccer team here in the UK, have tested positive, but they're fine. I'm glad they're doing well, and they said they're waiting the test for the rest of the squad. Now, why the hell is a Premier League football team getting their whole squad tested, yet people in my department cannot get tested for the coronavirus? Hi, Mum. Happy Mother's Day. What's been happening?
So we know that the London ICUs are now not full, but starting to get that way. It feels like there's a lot of people coming through the front door. That's not the case with us, but we've seen a real uptick in activity in the last 24 hours. And it's interesting, actually, it's patients in their 50s and 60s mostly that are coming in. It's not really old folk. But I'm pleased to say most of the people that I've seen in the A&E department today have been sat there having a cup of tea on their mobile phones with a bit of a low oxygen level, and those guys are fine. They just need a bit of supplemental oxygen for a while.
And you think these are very likely COVID cases then?
But unfortunately there are one or two who are coming in very unwell and needing to go onto ICU and onto life support with ventilators.
Anyway, let's crack on with the shift, get into some scrubs and let's do this. Time is almost 3 o'clock, and what a change from last week where a few of my colleagues were seeing the COVID-19 patients. Now pretty much half of the patients I've seen are very high suspicion, and when you first see the changes on the X-ray, it hits home that we are in this now. When you first see it, the first time you diagnose it, it feels really significant, but I'm sure in the next coming weeks and months it's going to be a routine thing to see these patients. I do have a concern as well with the personal protective equipment. Currently we're seeing these high-risk patients in just surgical masks, which aren't designed to stop things coming through the side, and the policy isn't to see these patients with the proper fitting mask, the one that I had fit tested last week. That is a concern for me. Our hospital is providing masks to the guideline, but I think that guideline needs to change personally. I don't think we should be seeing high-risk patients without those FFP3 masks. I think many of my colleagues agree. Anyway, I'm feeling good, so I'm gonna have some food, crack on with it. I'll chat to you guys at the end. Okay, night shift over, and it was definitely a step change. It sort of felt like, I'd equate it to like a bad horror movie where you hear mumblings of a monster, you kind of see tracks and you hear sort of strange sounds, but then eventually you come face to face with it, and that's really what we came face to face with today.